Good evening, friends. I'm Dr. Aajay Shah, bringing you another great live on a Friday evening. Today, we have actually a great guest, Dr. Senait Adebo. I know her for some time through the Facebook contact. She's a pediatrician. She's actually a life coach, which I really admire because I sincerely think that more and more physicians should go out and get a coaching degree. She's also a parenting coach. So tonight is a special treat for all the young parents and for everyone to learn from Dr. Adebo about how to be successful as a parent and how to be successful at life. So let's welcome Dr. Senait Adebo. Welcome, Dr. Adebo.
Oh, thank you, Dr. Shah. I appreciate it.
Yeah. So please tell us again what kind of work you do and where did you train for your pediatric residency?
Yes, I am a pediatrician. Currently, actually, I'm setting up my practice, but I worked as a hospitalist before, and I did my pediatric residency at the University of Minnesota.
Wow, that's great. So let's dive into how we can make our kids a better health-wise, better citizen. So let's start with an important pillar. What is the role of healthy eating and whole food plant-based eating even for a growing child?
Yes, Dr. Shah, I really appreciate your work too. I love how you set up the 6 pillars of life, and I think those are really basic pillars for any adult living, but also for children too, right? So like you said, on the adult side, nutrition is the most important pillar. In a child's life too, nutrition is really important. You see the pediatric obesity rates, skyrocketing. Type 2 diabetes, we never had it like a few years ago, but we see a lot of type 2 diabetes in children. And so nutrition is really important in pediatric. And I think parents have to invest in it earlier, when a child is born. I'm a big advocate of breastfeeding. Breastfed children tend to be less obese, right? And the benefits of breastfeeding in mother child bonding, less infections. You can, I cannot like say all the benefits of breastfeeding. There are so many, right? Like economic wise and so on too. And so start early when the child is born, and then when we introduce additional food and stuff. I think the biggest problem and issue we have in this country is a lot of processing of the food, and that we don't prepare our foods from scratch. We either drive by fast food or get processed packaged stuff, ready-made cans, things like that have so many chemicals that are toxic to our body, not to mention the amount of sugar and things like that they have. And so nutrition is really important in children too, but there are so many other things parents can do to ensure that their child is growing and thriving well, which we can talk.
I think I agree with you. I think breastfeeding obviously is one of the most important thing a mom and a child can go through. And now we know more about even microbiome. Breast milk has a certain oligosaccharides which actually are digested by our bacteria, and it creates certain chemicals, including the small chain fatty acids. And so breastfeeding has an appropriate amount of protein, appropriate amount of carbohydrate, even certain antibacterial substances. So I think breastfeeding is very, very important. And like you said, nutrition starts at a young age. I think if you set a good standards in your house by preparing food yourself, having a child learn how to cook, and when they grow up adult, hopefully they will not rely on this fast food or going to restaurants, 7, 8, 10 times a week, and they will start cooking at home. And I think, so again, nutrition is one of the most important pillars. I'm glad you covered about breastfeeding, because many women don't realize breastfeeding is one of the earliest stepping stone in terms of creating a well-being in child's life. And I think breastfeeding, I cannot stress, as much as you are stressed. I mean, it's very, very important. So let's talk about physical activity for children. I know Michelle Obama was promoting physical activity when she was first lady. And I sincerely believe that we all should promote in the kids. Many kids are sitting in front of a phone or an iPad or a computer, playing a lot of video games, watching a lot of Netflix movies. So what are your views on physical activity?
Oh my goodness. Yes, that's, you are head on. The current lifestyle we have is that, especially with the pandemic, even the physical activity they get at school is no more there. And our children are in front of screens so many hours in a day. And obviously that's harmful to their developing brain, to their developing bodies and bones, and so you've seen that statistics and research have shown kids who are engaged in physical activities, who are mostly outdoor and who are using devices less, are developing better, socially, emotionally, um, in, cardiovascular health and things like that too. And so, yes, physical activity is also very, very important for our children to ensure that they get that physical activity. And our Academy of Pediatrics recommends that kids won't be on, shouldn't be on a screen more than 2 hours a day. But how many of our children are following that? You know what I mean?
Yes, no, I agree with you. I think physical activity, as I understand, is not just good for preventing obesity, cardiovascular health. Actually, it makes even kids smarter too. I think I remember a study where when the kids were asked to exercise 30 minutes in the morning before the school starts, their
Yeah.
grades improved, their grasping of the subject improved, their attention span improved. Even some of the MRI study shows that even brain volume improves too. So physical activity obviously is another second important pillar. That brings to the third pillar, which is also many times ignored, particularly with the screen time and Netflix movies and TV, is the sleep. So please tell us about importance of sleep in kids. And as I understand, kids actually need even more hours of sleep than even adults. So please give us your views on sleep.
Yes. Yeah, right on. A good quality sleep has shown to decrease stress, right? Um, and regulate your blood sugar better, to overeat less if you get a good night's sleep in adults, right? And it's not different in children, actually. Like you said, children require even longer hours of sleep. Like when they are younger, in the newborn period, they sleep about 20 hours of the day, right? And gradually that becomes shorter, but like a toddler, a 1-year-old needs at least 12 hours of sleep, 10 to 12 hours of sleep. As they get older, about 8 hours of sleep, 8 to 9 hours will be enough. But the problem is, like we mentioned earlier, kids are on the screen most of the time, especially in some homes, there's a TV in kids' bedroom, or there's an electronic device. And so children are on the devices and they're not getting the recommended amount of sleep they need. And that could be contributing to the obesity and learning issues, behavior issues we see. And so sleep is also another important part. And when we get at some point, I will talk also about what our children need from our parents so we can they can develop well. you know what I mean? That they can become a secure, motivated, and accomplishing and successful adults. What is the role of a parent? And so, you know, I would love to talk about it whenever, you know,
Yes, no, I
when
think
it's time.
I agree. I think that brings let's cover about the relationship. I think a relationship between child and parent, both father and mother, and also relationship within the family with siblings, and including uncle and grandparents, and also relationship with friends. I think so. Please tell us the importance of a healthy relationship in a child's life.
Yes, thank you for bringing that up. I think that's going to be the basic need a child has. You know, children have two basic needs that if they are not fulfilled, um, they will either try to find it in a negative way by misbehaving, or, you know, it's worse to fulfill their needs. You know, if you know their needs and you give them, they are likely to behave better and improve your relationship with them too. So the two uh, biggest needs kids have is a need for attention from their parents, and a need for power, a sense of control of their environment. All right. And so today's parents, we are all busy, we are running. And so, and we may not be intentional about giving the attention, the one-to-one quality time our children need to thrive. And so, like you talk about in adults, relationships, healthy relationships are key to success and mental health, and what else, even in stress reduction and stuff, right? And so this is the way you can establish your relationship with your children, by spending quality time one-on-one without distraction, you know, without electronics, without being on the phone, or, you know, or being on social media. Social media is now the biggest thing where it's taking parents time too, right? So if we, it's like investing your time earlier in the morning. You spend 10, 15 minutes, 20 minutes one-on-one with your child, whatever age they are, especially when they are younger, you know, an infant or a toddler. And it's going to pay off the whole day. They're not going to need and desire your attention and seek it by misbehaving or whining if you give them that attention. The other thing parents may not know, especially, I'm originally from Ethiopia, in the developing countries, I think most parents don't understand that kids start listening when they are in the womb, right? Several studies have shown that. And so, because they are not talking when they are an infant, most parents don't necessarily talk to them or things like that. But like starting that relationship, even in starting from the womb, you know, positive affirming words, speaking positive affirming words to your child, starting from when they are in the womb, and then after they are born, instead of just being on our mind, on our thoughts, being mindful when we are feeding them, changing the diaper and stuff, talking to them, reading books, you know, picture books, you know, they thrive on us speaking. You know, they develop their language skill better when we are talking to them, and they feel our love and our attention to them, you know, when we do talk to them. And you know, and so just the need for attention is important. The other thing is their need for control. So to avoid the power struggle, sometimes it would be helpful to give them like choices, you know, not necessarily tell them you do this or that's it, you know, give them choice, listen to their opinions and ideas, and it may not be right, and you can teach them. That's why we are here, right? Disciplining our children doesn't mean punishing them. It means guiding them and teaching them. We are here to guide and teach them, and if we start developing that relationship early and we start guiding them early, we are less likely to encounter all the problems we see with our children in this country. When they are teens, they're less likely to rebel and things like that if we start that foundation, that relationship early.
Wow, this is very impressive. You cover so well. This is very, very important for all young women to hear. And I think I like the way you describe that you should start talking to a woman should start talking to the child even when the child is in the womb. Matter of fact, I clearly remember a story from Hinduism that there was a person. His name was Abhimanyu, and he was in his mom's tummy. He was in the womb. And mom actually listened to one of the most complex war technique. And the Abhimanyu, the kid, while in mom's womb, listened to the whole technique, which was like hours and hours long. And he learned that technique while he was in the womb of his mom. I mean, again, so this is very impressive to realize that kids are listening even though when they are in the womb. And once the kids are born, I agree with you, all type of stimulation, including touch, tactile stimulation, including visual stimulation, maintaining eye contact, including auditory stimulation, like you said, talking to them and making them feel like as if they're already adult conversing with you, even though they may not be talking meaningful to you, showing them different picture books, showing them different subjects and objects. And I think those things, I agree with you. I think relationship with the child starts in the womb and it continues until the parent is there. I mean, I think even when the child becomes adult, I mean, their relationship continues. So I think kids rely on us, until we pretty much are no longer on this earth. And our kids, our son is 31, daughter is 25, and they still rely on us as parents. I mean, I think so. You covered it so well. I'm so impressed the way you covered it, particularly talking while the kid is in the womb. So let me ask you the next important pillar, and that's about substance abuse and alcohol. I've seen many teenage kids, even sometimes younger than teenage, are getting into different drugs, different alcohol issues. So please tell us how as a parent, we can prevent that. And if a kid already has it, how can we reverse that path for the kid so kid can get back on the right path?
Right. That's a very good question, Dr. Sham. And it's very, we see it as a big problem, especially in this time, in this day and age we live. And I think, kids and adults, why we sometimes tend to go to addiction is, to kind of cover something painful in our life that we don't like, right? For the most part. If we, so we tend to overeat or overdrink alcohol and things like that, to kind of avoid negative feelings we may be having because we don't want to feel them, right? Um, Nobody has taught us how to manage our thoughts and our feelings. And as you know, Dr. Shah, our thoughts create our feelings, right? And our feelings create our action or inaction, and thus our action would create a result. So, but nobody taught us that we can choose what type of thoughts we think, and how to be okay, feeling negative feelings. And but as a human being, when there's a sense of negative feelings, there's the fight and flight response that gets activated, and so we try to go and to kind of either we react to it or we try to avoid it by going, for some it's overeating or eating sweet chocolates. For others it's going to alcohols, to drugs and things like that. And so I think teaching our kids to just feel their emotions, showing them that they can change their thoughts and things like that. But I think the basic thing would be a strong parent-child relationship, right? And educating them the harms of these substances and the addictive potential they have. You know, the problem is once you get into that, um, it's tough to get away from addiction, right? You're gonna need more and more doses, the more you stay in that path, right? So, like, if you start drinking, let's say, a glass of wine a day, and then if it gets to 2 glass, um, you know, you're going to want more and more of it, right? And once you get addicted, and so it's tough to get out once the addiction is set in. But I think prevention is going to be key. Educating our children the harms of substances and things like that, and developing a good parent relationship early on, um, would be, I think, powerful to somehow decrease the chance, you know. And like, you know, if they're going to be exposed, if there are things that is going to expose them to that, let's say parties and things like that, maybe sit down and discuss beforehand, you know, how, if, you know, this question comes, like a friend invites them and things like that, how they can say no, or maybe prevent it, you know, remove uh, harmful relationships that are going to guide them to the wrong direction. I hope that answers. I don't know.
No, I think it's excellent, and I agree with you. I think prevention is the key because once a substance abuse starts, it becomes a very lengthy process to come back to a normal state again. So prevention is the key, and like you said, explaining the kid from the young age the harmful things about the substance abuse, including alcohol. And obviously, as a parent, you know you should not be doing any of the substance abuse yourself because kids learn from your behavior, not from your words. And I think very important thing is that giving time to kids and knowing who's their friends are. I think sometimes, like you said, avoiding certain negative influence and avoiding certain negative friends is the key thing in the life. And like one more thing you added, that child has to know that he or she does not have to reach out to a substance abuse or alcohol or any other drugs to feel good. They can feel good by talking to parents, talking to their family member, doing meditation, reading a book. There has to be a better way of overcoming their negative feelings and their down feelings. I mean, all negative feelings and down feelings does not need to be addressed by alcohol and substance abuse. They can be addressed by many positive things. And I think if we make habit as a parent that we use those positive things to overcome our negative feelings, kids will learn from us that this is the way my dad, my mom is doing it. Maybe I should do it too. So I agree with you. I think it's a role playing when it comes down to alcohol and substance abuse. That brings the next important pillar, and that's a stress management. As I realized, depression is now very common in kids, and I've seen that the average age now has come down to as young as 12 years old who are on antidepressants. And that's something of a new thing in the last 30 or 40 years. So please tell us how a child can learn to manage stress and how to prevent some of the mental disorders, including depression, anxiety, and many other things.
Right, that's a good point. Yes, I like how you said, you know, parents have to be role models for their children too. You know, we cannot tell our children don't drink alcohol while we are drinking, right? And we cannot tell them, oh, don't watch TV while we are binge watching. So the biggest thing is they do imitate us a lot. You know, they will do what we do, you know, whether we know it or not, whether we want it or not, they are going to imitate us. And so just being a positive role model is a big thing. Um, the stress management is is a good point, Dr. Shah. And I think as human beings, even adults, we don't know how to manage our thoughts and our feelings, or we don't know how to just be okay with feeling negative feelings. You know what I mean? It doesn't kill us, right? If we just stay with it, it will pass after a minute, right? But we try to run away from negative feelings, either by overreacting, or we try to suppress it by maybe overeating or drinking alcohol, or finding pleasures from the negative sources, right? Like you said, there are healthier ways of stress reduction. Exercise is a big one. Just some sort of exercise routine, especially aerobic exercise. I love running every week. I try to run once or twice, and I love the feeling I have afterwards. And so exercising is one form of stress management. Reading books for pleasure, journaling, prayer, meditation. So many studies have shown that people who are involved in some sort of spiritual rituals have less stress, right? Less chronic diseases and things like that. Stress is a culprit for so many illnesses and stuff we see in medicine. And so it's the same in our children too.
I agree. I think you stress it so well about exercise, journaling. Journaling is such an important habit we can create in our kids. I journal every day. And I think, to be honest with you, I think kids should start journaling when they are like 7, 8 years old. And that can be such a great, great memoir for them when they are 50-year-old looking back their journaling. And now with all the journaling apps and other things, it's so easy to journal. And those things can be available for next 30, 40 years. And I think I even look back, I started journaling just 3, 4 years ago. And when I look back my notes from 3, 4 years ago, I get such a great excitement to see what I was planning 3 years ago and where I am right now. I mean, journaling is one of the most important thing. And plus reading a good book. I think those things are the better way of managing stress. And again, that brings another next important condition in kids. Many kids at times have concern for ADHD. So please tell us that as a parent, how can they handle the diagnosis? Obviously, that's not end of story. That's not end of life. Many kids have it. So please tell us what ADHD means and what are the natural healthy options to overcome that. And if it doesn't help, what kind of medications one can use?
Yes, so that's a good point. I think so many studies have shown how, when kids are exposed to chemicals in the food, they get more hyperactive. Processed food, packaged foods, those that have so many colors, preservatives, things like that, have shown to worsen ADHD symptoms. And so healthy diets, like we talked earlier, non-processed, whole food, um, if preferred plant-based, add lots of vegetables and fruits. Exercise is another big one that has shown to decrease symptoms of ADHD. In kids who were diagnosed with ADHD after exercise, their ADHD symptom has improved too. And so, and behavioral therapy is what we call, rewarding behaviors that are desired, instead of focusing on the negative behavior and punishment, encouraging positive behaviors when they are sitting still, when they are doing the behavior that are desired, rewarding them, are some of the ways that we can manage ADHD non-pharmacologically, right? But if the behavioral methods and the other methods fail, there are medications. So the good thing is the medications are effective. Kids who start medication are able to focus better, they have better performance in their studies and schools. And so it's not end of the world to have a diagnosis of ADHD, like you said. It's something that can be managed with medication. Also, the medications are well tolerated for the most part. Also, there are some side effects like suppressing appetite, sleep disturbance is the other thing. However, if the kids take their ADHD medication early in the morning, their appetite during lunch might be down and they may not eat as much, but they will make it up at dinner. And there are also a lot of other things parents can do if weight gains and stuff is an issue. We can add like shakes, supplements, and things like that. But yeah, so the medications are really, really effective if we need to get that route. But exercise, avoiding chemicals, healthy, whole plant-based food has been shown to kind of help improve the symptoms.
Wow, that's great. Now, I think that's very important thing you cover. Next question is actually very common question, and that question is that how can we help our child to do better academically at school or even for that say college? Because at times kids have difficulty getting and maintaining good grades. At times they don't have any interest in reading. They don't have any interest in learning other life skills. So how can we motivate a child to maintain or achieve better grades and have a lifelong learning desire and also be better in terms of just learning about different skills in life? I'm not just asking to get good grades in math. I'm talking about just be a good learner and good inquisitive, good curious child.
Yes, that's a very good question, Dr. Shah. I think one of the things would be role modeling, showing you yourself, showing them that you are reading, you are studying, and you're not only watching movies and relaxing all day, right? And in children's behavior, positive reinforcement has been shown to work really well. And so rewarding desired behavior, when they one thing is to encourage them to read, and then when they follow our guidance and our encouragement, reward that behavior. Rewarding doesn't necessarily mean you give them something. It's just good job. I like that you're reading. That's good. It's gonna help you, and things like that. You know what I mean? We don't want to reward them like with toys or materially. You make them materialistic and you make them entitled, right? If they are getting rewards every time they do something. But just communicating your desire to them, not just wishing in your heart, you know what I mean? Speak what your desires. When you have one-on-one quality time with your child, that would be something you can talk about. It's not only our agenda coming across. Of course, listen to them, get what they're thinking and what they are saying, what's in their mind. And then you also can influence them, speak to them and talk to them, what is desired, right? How it's important to always learn, to always grow. You know what I mean? And
No,
I
I
hope
think I
that
agree.
answers.
No, I agree. Those are excellent points. And I like about you giving importance of positive role modeling. As a parent, you have to be a continuous learner person or curious person, number one. Number two, giving positive reinforcement. And doesn't have to be material, just like a good job or, giving the importance of the behavior or even sometimes taking them for a walk or taking them to a museum or taking them to a zoo as a treat after reading a book, adding one more positive behavior on top of an existing positive behavior. And I think
Right.
I think you also said, and I agree with you, that learning doesn't have to be just a school learning. It could be cooking together, learning a new recipe, learning about fixing a car, learning about fixing a lawnmower, any kind of learning when there is brain stimulation has to happen between parent and a child. And I think we don't have to be just strict about let's sit down and do math. Sometimes sit down and learn a chess together, or anything. You learn a new app on a computer. I mean, do something which is there is a some brain stimulation. So I agree with you. So that brings to my next important point, and I saw on your Facebook page actually, and that was about you actually talk extensively about how to overcome life limitations and enjoy life. So please tell us how we, even as an adult, but definitely for a child, how can we overcome our life limitations? Again, limitations is a very relative thing. We all have different limitations, different level of things. But how can we overcome our limitations and start enjoying, start celebrating our life?
Yes, wow. That's a big topic. We may need an hour to cover this.
Yeah, yeah.
But yeah, so most of us have limiting beliefs about our ability, about who we are, about what is possible from the way we're raised, or from how our parents talk to us, or how maybe a teacher told us. For example, I was like in elementary school, and my teacher wanted me to write a writing, and I wrote and I submitted it. And no, before I wrote and submitted, I wasn't sure how to do it. So I asked her, how do I write it? And she gave me an example. And so, and then I wrote and I gave it to her, and she was like, even after I gave you example, you wrote badly. This is not right. You did a terrible job. And then I said to myself, I am not a good writer. I believed that, and I took that with me. And so I didn't even try to write until, my husband looked at some of the emails I write, and he said, oh my goodness, you write really well.
Yeah.
And so that limiting belief was broken. And so most of us have a lot of limiting beliefs like that. Maybe a school friend say something, or a teacher said something, and until we are the age of, let's say, 7, I think the study says up to the age of 7, you believe everything you're told. You just take it as it is. You don't even process it. You don't question it. You accept as it is. And the thing is, they become a belief system in our life, and they do hold us back because we believe them. They are ingrained in us. And so, but starting to quiet that down, and just noticing your life and what patterns you might be creating in life, or what things do you say to yourself, and is that really true? Most of us say negative things to ourselves over and over, but those are not right. Those are not true. They are based on who what somebody said when we were really, really young, right? But we believe them and we take them, and they shape our life. And so it's my biggest passion to overcome limiting beliefs and become who we are created to be.
Wow.
There's really more to
Yeah.
our human potential.
Yeah, no, I think that's I mean, you described it in such a, simple but very eloquent way. And I think our self-limiting thinking starts at a very young age. And I think sometimes it's very hard to overcome those things. And I think I've seen many examples of that. And I think at the same time, I personally believe that every child and even every adult has a basic human right to overcome those limitations. And I think sometimes getting a counseling, or sometimes talking to friends, sometimes almost like getting a second or third opinion. Like if you had asked one of your other teacher about your writing, maybe other teacher would have said that your writing was great. So I think you don't have to rely on just one opinion. But I agree with you. I think it's our responsibility as a parent that if child has any of this kind of thought, either from a friend or from a teacher or from any other adult, we overcome those thoughts by giving a positive reinforcement, a positive message that no, that's not true. I think many, like you said, many times before age 7, we take everything as a, just like a, as a truth, and I think that's not always the case. So I think you are so right about even adults. I mean, like I go through those kind of things even in my own life. But I have learned one thing now myself, that sometimes I have a self-reflection. I look at totality of my life, like what I have achieved, what I have not done. And obviously, we all have certain things which we are not good at. We all have that. But at the same time, when we look at our life in totality, we realize that we are good at many things. And I think kids has a right to think the same way. But kids, I tell all the parents now that never hesitate to sit down with a child or even have a counseling for the child if they are going through any of this self-limitation thinking. I also know about this automatic negative thoughts. They call it ants. And automatic negative thoughts are also so detrimental to kids' life and even adults' life. Many times when we are sitting alone, we have such a negative thinking going on about ourselves, and that's a really a pitiful thing, because that's not a healthy way of thinking about ourselves. So I agree with you. I think so. We cover a lot of things, important things. Next question is a importance, because you have now become a life coach, a health coach. Next thing is the importance of having a life coach in life, because parents can do that, but at the same time, as children grow up, as we grow up as adults, there's nothing wrong having a life coach or a health coach. That can be a friend, that can be a paid health coach, but those things, in my opinion, are investment of time and investment of money and investment of resources. So please tell us the importance of having a life coach in life.
Yes, yes, for sure, for sure. Yes, the thing is, like we talked about, some of the limiting beliefs, we are totally blind about them. Sometimes, I realize that, and I gave you an example, right? But I probably have some limiting beliefs that I need to get over, right? That I'm blind about it. But a health coach will help you identify what limiting beliefs you may have, and they will give you encouragement, accountability, and get over the habit of pulling yourself back, right? They will give you a push. It's really, really worth the investment to invest on yourself, on your growth, on your life involvement. And so hiring a life coach is valuable. I just cannot even explain the value of that. It will pay off in your relationship, in your career, finances. Most of us do have limiting beliefs that are affecting our finances, our relationships, our careers, our day-to-day life, our enjoyment of every day too. And sometimes we are really blind to what they are. But the beauty of a life coach is they will shine light to that, and they will help us see it and help us overcome it.
Wow, very, very impressive. You describe it so well. So next thing I watch on your Facebook page again, that you gave us a great concept of being a thermometer versus a thermostat. So please explain what it means.
Yeah, so good point. So a thermometer changes the temperature as the external temperature changes, right? But the thermostat keeps the inside temperature despite what's happening externally. And so when you work on your life, when you work with a life coach, let's say, and you identify the blind spots you have in life, your limiting beliefs, and you overcome them, you're not going to change by the external environment. You have an amazing joy inside of you, amazing confidence in who you are. And so you don't care what people are saying, or you know what I mean? You don't change your feelings based on what's happening externally. And it also comes with having a good spiritual connection too, right? if you are trusting and believing in your creator, whatever is happening externally, the chaos, the pandemic, the economy won't bother you, right? You will keep your internal temperature.
Wow, that's so, yeah, I mean, such a simple, elegant way of saying that we all should be thermostat. And I think I agree with you. I think, just you said such a right way. So let me ask you the final important question. You have podcasts, you have online programs. So please tell us how our viewers, how many parents can reach out to your programs, your podcasts, and about your program which you offer online. How can they reach out to you?
Yes, so I actually have a YouTube channel, not a podcast yet. My YouTube channel is by my name, Senait Adebo. If you just search my name, you can find me. And my website is gigcoaching.com, G-I-G coaching.com. You can also find me on social media on Facebook, Instagram, or Twitter by my name, Senait Adebo.
Oh, nice. Dr. Senait Adebo. So I think we covered a lot today. I really appreciate you coming on. And again, I'm always impressed by a physician who has taken extra efforts to become a health coach or a life coach because by definition, most physicians are not good coaches. They are good at prescribing medications. They're good at doing procedures. But when it comes down to changing behavior, when it comes down to changing mind and the heart of their patients, they're not good at it. So I really admire you getting a coaching degree for yourself, for your family, for your friends, and definitely for your patients. So that's a great thing you got on your side now. So again, thank you very much, Dr. Debo, and we will have you come back in a few months to catch up on more pediatric issues. So thank you again.
Thank you, Dr. Shah, and thank you for all the things you do too, educating the public about health, nutrition, in a way to decrease the diseases. The disease burden we see in this country could have been prevented. Like you said, most physicians, most of us, take the time to counsel and coach our patients, right? Thank you, Dr. Shah.
Yeah. Thank you very much. Yeah,
Take
thank you.
care.